today we're going to be showing you some proper wound care techniques and procedures.
Today I will be showing you how to properly set up and assist the provider with suturing of a wound.
And I will be removing a patient's staples from their incision that has been healed using a sterile technique.
And finally, I will be showing you how to properly apply the sterile adhesive skin closure strips. Now remember, with any patient and procedure, it's important to always verify your procedures, order beforehand, properly greet your patient, and introduce yourself.
You also need to verify your patient with full name and date of birth, explain the procedure to them, and make sure they understand.
And then also check for their consent forms and identify any allergies that they have, tetanus stats, or any other health concerns, and answer any questions that they might have.
Thank you. I hope you enjoy.
Okay, hi guys. So today I will be showing you how to properly set up and assist the provider with suturing of wounds. So first, you will need to sanitize your hands and gather your supplies. Sterile tray, you will need syringe and needle, curved hemostats, thumb tissue forceps, a needle holder, curved iris scissors, a wound closure instrument tray, and some gauze. Okay. On the counter next to you, you will need anesthetic, sterile gloves, bandages, and tape, a sling or a brace just in case, and a sharps container, and a biohazard. So now that we have everything set up, we're going to go grab our patient and assist the provider with whatever they need.
Hi, so today I'm going to remove a patient's staples from their incision that has been healed using a sterile technique. And what you need for this procedure is a suture removal tray, sterile surgical gloves, the gauzes, the antiseptic wipes, the surgical staple remover, and the thumb dressing forceps, and a dry towel like this, and a biohazard for the sharps, and over here another biohazard. Hello, my name is Joanne, and I'll be removing your staples for today. First, I'm gonna sanitize my hands. How are you?
Good.
Yeah, that's good. Okay, so the first thing you do is to place a dry towel under her arm and to check the incision site to make sure the wound edges are approximate and that there are no signs of infection, inflammation, edema, or any drainage. And as you can see here, there's none. Okay, now I put on some gloves. I am going to use an anesthetic wipe to clean the wound to remove any exudate. So, okay, perfect. And now I'm gonna remove my gloves. Over here. So now I have my sterile gloves, and now I'm going to remove the staples from her wound. Okay, so first I'm gonna put the gauze over here, and then I'm putting the biohazard, and every single one I'm gonna do that. You feel okay? Mm-hmm. Okay.
Okay, hi, today I'm going to show you how to properly apply the sterile adhesive skin closure strips to your patient's wound. The supplies you're going to need for this, over here on your sterile tray, you're going to need your steri strips. There are different sizes. You have to choose the right size depending on the patient's wound. You're going to need your sterile gauze, your tincture of benzoin for the adhesive. You're going to need your Adson dressing forceps, some straight iris scissors, and then the applicator for the benzoin. Over here on your counter, you're going to need tape, antiseptic wipes, bandages, and sterile gloves. Okay, now that we've got all our supplies, and assuming that our patient's wound has already been irrigated and cleaned out, we are going to put on some gloves. And we're going to clean around the wound or incision just with an alcohol wipe so we can clean the area for the steri strips to stick. Clean around about 2 inches. Be careful not to touch the incision. Okay, now that I have my sterile gloves on, I'm going to grab my swab for my tincture of benzoin, and we're going to apply to each side of the incision so that our steri strips can stick. Next, we're going to open up our package of steri strips and grab our Adson dressing forceps. We're going to peel off a steri strip. We're going to use your fingers to gently push together the two sides of the wound as far as you comfortably can. You're going to start by placing one part of the steri strip and then placing the other side on the other side of the incision. And you are going to repeat this for as many steri strips as it takes up the arm. Okay everyone, I hope you enjoyed all of our procedures and our teaching videos. Just be sure to remember with these procedures and with any procedures you perform, always make sure that you are checking on your patient, making sure they're feeling okay during the procedure or after. Make sure that you address any questions or concerns they have. Also be sure to provide them with proper post-op care instructions.
Also educate them on how to properly care for and clean the dressing or wound, and let them know when to seek medical care if problems occur, such as abnormal bleeding that won't stop, or if it becomes red, swollen, or filled with pus, or if it becomes more painful.
And then lastly, to be sure to document the procedure in the patient's health record. And we hope that you guys have a better understanding on how to assist and perform better wound care for your patients. Thank you.
Thank you.
All our touch.
This on.
Today I'm going to be showing you how to apply the, okay. Cut that. I don't know what to do. Oh shit. Sorry. Next we're going to open up our package of steri strips. Let's try that again.